went to Europe this summer, and it was pretty good, except for like one of my friends, she actually got her phone stolen because she like left it in her back pocket, and there's a lot of pickpockets in Europe, so they like took her phone, but she didn't realize until she got off the bus.
Here we go.
Oh, excuse me?
Yes.
I just wanted to make sure these were the nut-free pancakes. She's allergic.
From my understanding, the regular pancakes don't have nuts.
Oh, okay. Well, thanks.
I'm so sorry.
Excuse me, Miss Stacy?
Oh my gosh.
Accidental exposure like this happens on a daily basis. Are you prepared to help someone when the time comes? We'll discuss the symptoms associated with food allergies and the step-by-step plan in which to treat someone who is currently having an anaphylactic reaction. To begin, let's review what anaphylaxis is and what may cause an allergic reaction. Anaphylaxis is an acute allergic reaction to an antigen to which the body has become hypersensitive. These antigens are often seen as harmless or normal to most people, but to those allergic, these normal, everyday items can become deadly. An allergic reaction can happen in seconds, minutes, or hours of encountering an allergic trigger. This includes, but is not limited to, food allergies, medicines, wasp or bee stings, general anesthetics, contrast agents, or latex. Symptoms of anaphylaxis may include shortness of breath, wheezing, difficulty breathing, difficulty talking or swallowing, hives, itching, swelling of the face, lips, tongue, or other parts of the body, shock, or asthma. Other symptoms may include narrowing of the airways, rashes, hoarseness, nausea or vomiting, weak pulse, and dizziness. Individuals may experience anaphylaxis and not show any skin symptoms. Before we continue, let's clarify what anaphylaxis is and isn't. Anaphylaxis isn't just an upset stomach, highs relieved by Benadryl, or just itchiness. Anaphylaxis is a potentially life-threatening event. Severe anaphylaxis is the combination of any two body systems reacting with specific symptoms present.
All right, everyone, be safe. Have a good recess. I'll see you all after.
Mr. Belzler,
Hey, bud, what's going on? Is everything all right?
I don't know.
Can you tell me what happened?
Jessica gave me some cookies, and now I feel weird. My chest feels funny. I don't know. I want my mom. Am I gonna be okay?
Everything's gonna be okay. Let me call the nurse. I don't know what to do. Here. Do you remember what kind of cookie it was?
I don't remember.
It's okay. We'll figure this out together. Hi, yeah, I'm in room 116. One of my students is having some sort of allergic reaction. I'm not too sure. It seems pretty bad. Can we get a nurse in here right away? Uh-huh. Thank you. It's gonna be okay.
Within the last 2 years, 18% of children with food allergies have had an allergic reaction while attending class. Educators and parents alike must learn what symptoms to look out for and how to properly take action. So, what are the signs of anaphylaxis? We'll start with skin. One of the visual signs of anaphylaxis could include the swelling of the tongue, eyes, hands, or feet. It's important to note that it doesn't have to be all these symptoms all at once. It can be one or multiple parts. But as long as you have one of these body parts swollen, you have the symptom of skin involved. Although hives are considered a skin symptom, we categorize this finding separately. During an allergic reaction, the hives we are referring to appear on multiple areas of the body and continue to develop after taking Benadryl. For example, your child develops hives. You give them Benadryl. If after 10 to 15 minutes the hives are larger in size or spreading throughout their body, it is considered skin system involvement. If hives improve or stay exactly the same, then it is not a system. Another body system that can be affected during an allergic reaction are the lungs and throat. If the patient has symptoms such as wheezing, this is attributed to the closing of an airway. In most cases, it causes a whistle effect when the affected breathes in and out. If the patient communicates that their chest is feeling heavy and tight, this is a sign of bronchospasm, which is a sudden constriction of muscles that align the airways in the lungs. Upon these muscles tightening, the airways narrow. During a reaction, you may hear hoarseness in the voice or a change in character of the voice, indicating that the person having a reaction could be having inflammation of the vocal cords or throat. The patient may also have trouble swallowing saliva, which turns into profuse drooling. The same concept applies here. The throat is closing and constricted, and the patient cannot swallow correctly, therefore causing drooling. You can easily assess whether or not the patient has this system by asking them to count to 10. If the patient is able to count to 10 in a single breath, then you know the child is fine. However, if the patient is unable to count past a few numbers, you know that there is an obstruction or constriction in the throat or lungs. Another easy way to assess the patient is to observe them visually drinking fluids. If the patient has difficulty drinking or swallowing water, then you know the lung and throat system is involved. If the patient has one of these symptoms present, you have the lung and throat system, or pulmonary system, involved. If the patient has repeated vomiting, profuse diarrhea, or dry heaving, then the stomach or gastrointestinal system is involved. The key word here is repeated vomiting. The pattern of nausea to look out for is vomit, visible pause, then vomit again. Let's say the patient vomits everything all at once. The patient may vomit a lot, take a visible pause, still feel upset, want to vomit more, but instead continually dry heaves. In this situation, it qualifies as the involvement of the stomach system. However, feeling like you have to vomit or feeling nauseous on your own does not qualify for the stomach system. Finally, the patient may have an altered state of consciousness or faint as a result of a drop in blood pressure, as the patient is no longer receiving enough blood to the brain. Ultimately, the patient will pass out. As a reminder, you need to have a minimum of one symptom from 2 different systems in order to be considered anaphylactic. If 2 symptoms are present, then the patient is experiencing anaphylaxis.
Hi, my name is Kristen and I'm one of the nurses here at Food Allergy Institute. Today we're going to be going over the proper administration of an EpiPen. In case of an anaphylactic reaction in an area where there are no doctors on site, the use of epinephrine must be administered through an EpiPen. Thankfully, the use of an EpiPen is easy to learn and will be your best tool during a life-threatening anaphylactic attack. Please note, these instructions are based on the commonly used EpiPen. If your doctor has prescribed you a different epinephrine injector, be sure to follow the instructions as written by the manufacturer. Other forms of epinephrine injectors include Auvi-Q, Symjepi, authorized generics of EpiPen and EpiPen Jr. by Viatris, formerly Mylan, and generics of EpiPen and EpiPen Jr. by Teva Pharmaceuticals. To begin, if the device is in a carrier tube or package, please remove it before using. Also, it's important to check the expiration date on your EpiPen. If it has expired, do not use the injector. If you notice that the liquid is cloudy, do not use it. You should be able to see visible, clear liquid. If possible, we recommend putting on gloves before administering the injection. If you are deploying an Auvi-Q auto-injector, you will also remove it from the sleeve and check the expiration date. If it has expired, do not use the injector. If you notice that the liquid is cloudy, do not use it. You should be able to see visible, clear liquid. Locate the outside middle of the person's thigh. If you are giving the injection through clothing, make sure there are no obstructions. Remove the blue safety release and hold the auto-injector with the needle end perpendicular to and near the outer thigh. Quickly and firmly push the tip straight into the outer thigh. You will hear a click indicating that the spring mechanism has been triggered. Hold the auto-injector firmly in place for a minimum of 2 to 3 seconds in order to deliver the medication. Then, remove the auto-injector from the thigh and massage the injection area. Once the injection has been given, you'll need to recheck the person's breathing and observe how the person responds to the medication. If the person still shows signs or symptoms, a second dose may need to be administered in the opposite thigh. The most important step you can take in an emergency is to activate the EMS, Emergency Medical System, by calling 911 or your local emergency number. Once you've administered the EpiPen, call 911 immediately. This could be a matter of life or death. Once you've completed the injection, you must properly dispose of the EpiPen. Remember, improper disposal of an EpiPen can lead to severe illness and spread blood-borne diseases. It is important to treat a used or expired EpiPen as toxic waste. After use, immediately return it to its container in order to avoid a needle stick injury. If you have a sharps container, you can place it there. If you do not have a sharps container, you can put it in a heavy, sealable plastic container until you are ready to dispose of it. Some states allow you to transport used EpiPens in medical waste bags. These puncture-resistant bags are usually color-coded red and clearly labeled with a biohazard symbol. Some healthcare providers will offer these to patients who use EpiPens. There are several places you can take a used EpiPen. A designated sharps disposal drop-off site operated in many communities, to the healthcare provider who prescribed the EpiPen, who can also give you a new prescription, a nearby hospital, or your local pharmacy. Call in advance to see if they accept used sharps. If your EpiPen is unused and expired, you can dispose of it through drug take-back programs in many communities. The Drug Enforcement Agency, DEA, has a registry of authorized drug take-back locations, which you can access through the EPA's online locator. Some pharmacies also offer on-site drop-off boxes, mail-back programs, and other ways to help you safely dispose of unused medicines. Your healthcare provider will also usually take back and dispose of expired auto-injectors. If you know that your child suffers from any sort of anaphylactic allergies, please have an emergency care plan available. These plans should include what your child is allergic to, what epinephrine injector they have been prescribed, with instructions on proper use, emergency contact information, and any other important information that can help save your child's life.
In our final section, let's review one of the laws that pertain to the response to an allergic reaction, the Good Samaritan Law. If you are in a situation where a parent or medical provider is not around to administer an EpiPen, you may think to yourself, if I administer the shot without the consent of a parent or medical provider, will I get in trouble? According to the Good Samaritan Law, an individual who, in good faith and without compensation, administers epinephrine to another person believed to be suffering an allergic reaction when a healthcare professional is not immediately available will not be held legally responsible. They can be held legally responsible if they act with extreme carelessness and intentionality to cause harm. Generally, Good Samaritan laws only offer protection for those individuals who provide care during spontaneous emergencies unrelated to volunteer deployment. Notwithstanding any other law, a person may administer epinephrine to another person who is suffering from a severe allergic reaction if the person acts in good faith and without compensation for the act of administering the epinephrine and a health professional who is qualified to administer epinephrine is not immediately available. A person who administers epinephrine pursuant is not subject to civil liability for any injury that results from that act, unless the person acts with gross negligence, willful misconduct, or intentional wrongdoing. Certification. Upon certification by the EMS authority, as defined in Section 100044.6, a lay rescuer, or off-duty, pre-hospital emergency medical care personnel are authorized to administer an epinephrine auto-injector to treat a person who is suffering, or reasonably believed to be suffering, from anaphylaxis under the following conditions. 1. The epinephrine auto-injector is legally obtained by prescription from an authorized healthcare provider who may issue a prescription for an epinephrine auto-injector to a person described in this subdivision for the purpose of rendering emergency care to another person upon presentation of current and valid certification card issued by the EMS authority. And 2. The epinephrine auto-injector is used on an individual with the express or implied consent of that person to treat anaphylaxis. And 3. The epinephrine auto-injector is stored and maintained as directed by the manufacturer's instructions for that product. And 4. The emergency medical services system is activated as soon as practical when an epinephrine auto-injector is used. Certified persons shall make, maintain, and make available to EMSA upon request a record for 5 years reflecting 1. Dates of receipt, use, and destruction of each auto-injector dispensed, and 2. the name of any person to whom epinephrine was administered by using an autoinjector. And 3. The circumstances and manner of disposal of any autoinjectors. The training standards prescribed by this chapter shall apply to lay rescuers and off-duty pre-hospital emergency medical care personnel. For this test section, you will be given 7 multiple choice questions, 3 true or false questions, as well as a matching section in order to review the lessons and concepts covered in this training video. Following each answer, a short explanation will be provided as to why each answer is correct. Anaphylaxis is the development of signs and symptoms in 2 major system categories. For the gastrointestinal, or stomach system, symptoms can include stomach pain, throat tightening, vomiting, and diarrhea. For the respiratory, or lung system, symptoms can include cough, wheezing, difficulty breathing, chest pain, shortness of breath, or chest tightness. For the skin system, you might see hives, swelling, clamminess of the skin, or itching. For the cardiac or heart system, symptoms may include feeling faint, lightheaded, dizziness, or heart racing. For the neurological or brain system, symptoms may include anxiety, headache, confusion, or loss of consciousness. The ideal location for injection is in the middle of the outer thigh, regardless of clothing. Taking time to change or remove clothing are critical seconds that should not be wasted on delaying treatment to an individual experiencing anaphylaxis. Injections into the buttock is not recommended, as it is a less effective injection site and can injure the surrounding tissue. Injections near extremities, such as the fingers, toes, hands, or feet, can result in circulation injury, as it will result in decreased blood flow to the area. It is important to hold the epinephrine autoinjectors stable and in place after injecting for 2 to 3 seconds. Different manufacturers have different requirements, but it is safe to say at least 3 seconds. Refer to current manufacturing recommendations for specific autoinjector products. Although you can hold it in place for a longer period of time, it is not necessary. Although peanut and tree nut allergies are the most common causative agents, individuals can be allergic to almost any food allergen. Other common causative agents to consider include soy, milk, wheat, eggs, fish, shellfish, and sesame. Foods like cake can contain allergens such as peanut, tree nut, wheat, eggs, and dairy products. Commercially produced food products are required by the Food and Drug Administration, FDA, to specifically label products containing major food allergens according to the Food Allergen Labeling Act of 2004, FAL-CPA. It is also important to know that there are food allergens present in non-food products that can pose a risk for food allergic patients. Play-Doh, for example, is commonly made with wheat flour, which can be an exposure risk to wheat allergic individuals. Insect stings such as bees, wasps, or hornets can also induce an anaphylactic reaction. All epinephrine autoinjectors have an expiration date and are best to be used before this date has passed. There have been some extensions approved by the Food and Drug Administration, FDA, in times of medical shortages. Some sources report that medications are stable beyond the expiration date by up to 4 to 9 months. It is recommended that you reference the most recent manufacturing parameters and FDA website for current recommendations. Regardless of expiration date, if the medication window reveals medication solution to be discolored, cloudy, or containing floating particles, it should not be deployed. The epinephrine autoinjector window should reveal a clear and colorless solution. Although it is important to know when a food allergy is present, there are many cases where the presentation of anaphylaxis is the first sign of allergic disease. These individuals may not have a known history of food allergy, and therefore, relying on the ability to identify the signs and symptoms of anaphylaxis is imperative. Although anaphylaxis can occur when an allergen is ingested, there are allergic individuals who can react to skin, aerosolized, or food transferred by simple touch. Some allergic individuals can react when exposed to even the smallest contamination of their allergic protein, and awareness of food products with cross-contamination with allergens can be a concern for safety. Epinephrine autoinjectors should be stored at normal temperatures. Extreme temperatures can degrade the medication's effectiveness. Cars can experience extreme heat and cold, depending on the external temperatures. Refrigeration or freezing injectors is not recommended, nor should you store them in bathrooms where warm steam is common, as these storage conditions can affect the effectiveness of the medications, as well as the injector mechanisms. Epinephrine autoinjectors, used or unused, can be a danger to others and must be discarded in the proper manner. Autoinjectors are not recyclable, nor are they to be discarded in the typical waste disposal. Research medication take-back programs in your area. Generally, many hospitals and pharmacies provide these services. A deployed autoinjector can also be sent with the emergency medical team, along with time of deployment for care purposes. The Good Samaritan Law exempts from legal liability a person who attempts to give reasonable aid to another who is injured or otherwise imperiled.